is Bordador. I work in Mercy Hot Springs. I've worked for the hospital for 2 years now. There was something different about being in this facility. One of the things that I did find special about being here was that it's a Catholic institution. I myself am Catholic, and I was happy to be part of a place that had a mission and also that celebrated faith. Well, it always sounds like the non-textbook answer, but when I went for a med school interview, my answer was, well, I like science and I like helping people, and I thought that it was a logical combination of the two. I guess it really depends on the demographic if you think about it. With those who are poor, with less access to care, I feel they're all the more marginalized and they actually need and deserve more of our attention. Those who are actually more fortunate, actually it's irrespective of how deprived you are of care or how good the access is. I think that it's your right to be cared for. I think that it is something that people deserve, and I think that I think that my utmost effort is the least that I could do. I know that I have my human limitations. I don't profess to be the greatest physician, but at the very minimum, I owe each patient that I encounter all of my attention and all of the effort that I can give to them. The first month that I was here, I did have a patient who was severely ill with a gastrointestinal bleed, and I was amazed how quickly the nursing staff responded, how easily I could reach the specialists that I needed to, and I was convinced that if I had been in another hospital that this patient would have died. And I was amazed that within 30 minutes the patient had been stabilized, though he was very sick, that with the involvement of the other physicians, that his life was saved, and he although he was quite ill, that he did have the chance to improve and have more time to live out his life.